When Violet McManus was born, her parents were thrilled. She was their first child, a perfect little girl who met all of her developmental milestones.
She was learning to pull up, and she was saying mama and dada. It was just really, really great.
She was just the best thing in our lives.
Trista Pandaleos felt the same way when her daughter Olivia was born.
I was very excited I was having a girl. When we found out, we were beyond excited. Everything was fine with the pregnancy.
These children look very different, and their families may not have much in common. But before their first birthdays, one significant, life-changing similarity would emerge.
When she was 10 and a half months, she had her first seizure. We flipped on the light and she was completely blue, and there was bubbles coming out of her mouth. So then we called 911, and she had hundreds of seizures within 2 weeks of being hospitalized. She was never the same child after that. She stopped speaking. She didn't know who we were. She was gone. I couldn't really formulate what was happening. I'd never seen a seizure before in my life, and I just was panicking. So I called 911 and just said, please come quick. I don't know, she's gonna die.
Over the years, doctors would try dozens of medications to control the girl's seizures, and their desperate parents agonized over what might have caused their child's illness. Julie Walters feared something in her home led to Violet's seizures.
We did everything we could think of to get the chemicals out of the house. I mean, I was really strict with her diet. She couldn't eat anything that wasn't organic, and it was a lot of nights on researching chemicals and what they do.
She also worried about the future of her family.
We were very scared because we actually thought I was pregnant when this started. We really wanted to have a second child, and we went to our neurologist. We said, what are the chances of this happening to our second child? And he said, well, the chances are pretty small, but there's some tests I can run.
One of those genetic tests is an epilepsy panel. Another, a microarray, showed Violet had a mutation in the gene called PCDH19, a problem found rarely in males and more often in females. Julie and Matt were not carriers, so Violet's mutation was a random event, and that meant her little brother, Rory, was at no increased risk for the disease.
Rory wouldn't be here if it wasn't for that. I don't think I would have had the nerve. I know my husband wouldn't have had the nerve to have another child.
To learn more about PCDH19, Julie and Matt went to the internet. That's where they met Karen and Bart Kilpatrick, whose 14-year-old daughter, Kira, has PCDH19 and autism. Doctors say it's not unusual for kids with this genetic condition to have cognitive problems and developmental delays.
You can actually have many different symptoms of abnormal brain function, one of which is seizures, but other signs such as learning problems, reading problems, language problems, and probably in its most severe form, the true autistic type picture.
Children with PCDH19 usually have their first seizures between the ages of 3 months and 3 years. Often these seizures are triggered by fevers, include fearful screaming, and occur in clusters.
A single seizure in and of itself is bad enough. It comes out of the blue, it's unexpected, we can't really anticipate when it's going to happen, and we don't know what direction that cluster is going to go. So could that cluster actually stop with appropriate intervention, or is it going to spiral out of control and result in a hospital admission, and many times a prolonged hospital admission?
Some patients have normal development and intellectual abilities in spite of their seizures, but about 70% have intellectual disability. Autistic and psychiatric features such as aggression, depression, anxiety, OCD, and psychotic traits are also common, as is expressive language delay. Finding the right medication to control the seizures is a process of trial and error, in part because so little is known about PCDH19.
They don't know how a mutation to this protein causes seizures. Is it a sodium channel thing? Don't know. Is it something to do with synapses? Don't know. And how can you actually go to treat it better, more effectively, instead of just this trial and error on the drugs that may or may not work and cause a lot of side effects. So there's a need for more targeted drugs for this disorder that would work more effectively without trial and error. And if there's any hope to ever perhaps curing it, they're going to have to understand it.
That's where the PCDH19 Alliance comes in.
Successful organizations like the PCDH19 Alliance are able to bring together medical providers and researchers to not only improve the day-to-day care of these patients, but also fund cutting-edge research that will hopefully make the overall care for these patients much improved.
The group sends information and tokens of support to parents who are new to a diagnosis of PCDH19.
I think it's a lifesaver to know that there's other people out there. You know, you're not the only one. You may be the only one in your town. You may be the only one for your neurologist, but there are other people out there, and we're in this together.
Because it's so rare, I mean, we are international. We have to find each other all over the world. If she's up in the middle of the night having seizures and I can't go back to sleep, or I need some reassurance or just to know that I'm not alone, that somebody somewhere in the world is awake at 2 a.m. Usually it's the Australians are up and can commiserate with, and that's really nice.
A lot of our friends don't really understand it, and they never will. And it's only the people that have it happen in their own lives that really understand.
The Alliance also allows parents to share practical information and resources. Julie Walters and Matthew McManus, for example, get help from a home nurse through a government agency.
Helen has been with us since Violet was 2, and it is very difficult. I get like this because so many families don't have someone like Helen, and without her, I wouldn't be sitting here right now because she's here right now. You know, even as simple as to go to like Home Depot to get something, Violet just couldn't handle being in the store.
The Kilpatricks qualified for a service dog. This specially trained canine often warns the family a day in advance if Kira is on the verge of a seizure.
She'll get really frantic and excited sometimes about a day before my daughter has seizures.
The dog has been huge, and if we would have known, we might have done it sooner.
In addition to suggesting resources, the Alliance raises money for research and funded a registry of patients to help science understand the full range of clinical features associated with PCDH19. The group promotes public awareness through printed materials, social media, and a presence at medical conferences. Through its Facebook page and website, it provides support and advocacy, offering patient assistance grants for things like seizure monitors and iPads for kids with autism and learning disabilities. Finally, Alliance parents and other caregivers offer suggestions on how to live with PCDH19.
My advice to other parents that are newly dealing with seizures is don't be afraid to ask your doctor. Question what they're telling you. Make sure that you're at a major center that's going to run genetic testing, that's going to have the latest research information, and make sure you feel comfortable with your doctor because you're probably going to have a relationship with that doctor for a very long time.
Karen Wells Kilpatrick says it's important to pace yourself. When possible, she takes time to work in her studio, making intricate objects from glass. Her husband plays evenings and weekends in a band.
Mostly it just recharges and refreshes me. And at first I used to feel guilty about going away and on Friday and Saturday nights and playing, with my friends and was I being a bad husband or whatever? And then I realized I need this. I'm a better husband and a better father after I've played a gig.
Finally, the Alliance offers hope to families with children who have PCDH19.
Researchers believe that PCDH19 affects 1 in 10 girls that begin having seizures before the age of 5. And if we can find a cure for this or treatment that works, it may lead to treatments for other things as well.
You don't know what tomorrow brings. You don't know what the next minute brings. We need money to be going towards research and understanding more about the future of this condition.
Don't give up hope because there are brilliant minds out there working on this every day. There's other families going through the same thing, and you're not alone. I think that's the main thing, is that you're not alone, and working together, we can come up with something to improve the quality of life for everybody suffering from seizure clusters. There's an answer out there. We just have to find it.